Hello everyone, how are you today? I'm Dr. Paramjeet and you're watching Dr. Education. Welcome to my channel. As you know, I make videos about health and healthcare topics, and a lot of videos are there on my channel. You can watch them. And today I'm going to talk about obsessive compulsive personality disorder. This is a different kind of disorder. If you compare it with obsessive compulsive disorder, OCD is different than OCPD. Now, we are going to talk about OCPD.
If you want to know about health and have health concerns, then subscribe to my channel and hit the bell icon. You'll be notified about all upcoming videos.
OCPD, obsessive compulsive personality disorder, is a mental condition in which a person is preoccupied with three things: rules, orderliness, and control. Rules, orderliness, and control. Now, if we talk about what is the difference between OCPD and OCDs, although some of the symptoms are similar, but people with OCDs, obsessive compulsive disorder, have unwanted thoughts, while people with OCPDs believe that their thoughts are correct. Like, OCD people may be thinking, okay, maybe that doorknob is not clean enough. Maybe that painting is not clean enough, so they'll clean and again clean that painting. But they know that it's clean, but still they are not satisfied. In OCPD, if something is supposed to be kept there, that means it's supposed to be kept there. If shoes are supposed to be kept in the shoe rack means shoe rack. If you keep the shoes somewhere else, they cannot handle it because they think their thoughts are correct. They are not wrong. So they are different. OCD often begins in childhood, while OCPD usually begins in the teen years or early 20s. People with either OCPD or OCDs both are high achievers and feel a sense of urgency about their actions, right? They may become very upset if people interfere with their rigid routines. They may not be able to express their angers directly, but people with OCPD have feelings that they consider more appropriate, like anxiety or frustrations. So they consider these things appropriate. A person with OCPD has symptoms of perfectionism. Not exactly like Amir Khan. No, not like that. But these symptoms of perfectionism usually begins in early adulthood. This perfectionism may interfere with the person's ability to complete tasks because their standards are so rigid they cannot actually go further without completing it perfectly. So they may withdraw emotionally when they are not able to control a situation. So this can interfere with their ability to solve a problem or create a close relationship. Sometimes they might have a problem. There are some other signs of OCPD which include over devotion to work, not being able to throw things away even when the objects are having no more value, lack of flexibility, lack of generosity, not wanting to allow other people to do their things, not willing to show affection. Sometimes that also happens. Preoccupation with details, rules, or lists is also seen. So all these symptoms are there with OCPD people. And if we talk about what is the reason, causes, OCPD tends to occur in families, so therefore genetics play a role. A person's childhood and their environment, the social and physical environment, also plays a role, and this disorder can be found in both men and women, and surprisingly it occurs more often in men. How can you diagnose it? Obviously only a psychologist, psychiatrist can diagnose it by a psychological evaluation, just like borderline personality disorders. and the doctor, the healthcare professional, will consider how long and how severe your symptoms are. Treatment: medicines can help. In this case, medicines are helpful, especially for reducing anxiety and depression from the OCPDs. Then talk therapy is thought to be the most effective treatment of OCPD here also, just like borderline personality disorder. But in some cases, medicines combined with talk therapy is more effective than either of the treatment alone. Prognosis, if we talk about, OCPDs tend to be better. Outlook for OCPD tend to be better than that for other personality disorder. The rigidness and control of OCPD people may prevent them from the complications such as substance abuse, which are more common in other type of personality disorders. But the social isolation and difficulty in handling their anger that are common with OCPDs may lead to depression and anxiety, especially later in life. So the complications can include depression, anxiety. Then relationship difficulties, difficulty moving forwards in a career situation. So that is all about obsessive compulsive personality disorders. It's different from OCDs where you have unwanted thoughts. Here you believe that your thoughts are correct. So hope you're liking my videos, guys. We talk about narcissistic and antisocial personality disorders the next time. So keep watching. Those who don't know me, I'm Dr. Paramjeet. I'm not a psychologist, not a psychiatrist. I'm a physician cardiologist in Yashoda Superspeciality Hospital, Nehru, Nagar, Delhi NCR. And this is my channel. I teach about health and healthcare topics. So this is one of the health topics. So here I am. So till next time, keep watching, keep sharing your thoughts, keep promoting my channel, and stay connected, stay healthy. In addition, even symptoms of perfectionism that usually begins from a or even form even then there are others over which include a person may have. So the healthcare professional will consider, in this case, medicines are helpful to reduce the anxiety, but the social isolation and the difficulty of handling anger, but the social isolation and difficulty in handling, just like behavioral therapy, just like borderline psychological, just like borderline